Pastor is taking your medical questions at 270-9933.
So get him in right now. Go ahead and give that number a call. In the meantime, he joins us from his office in Oregon. Hi there, Dr. Pastor. How are you?
Good. How are you guys doing?
Not too shabby.
You're holding a seminar this week on falls.
Right. What I did today, actually, I was out on right around the east side in Cottage Grove at the Door Creek Church, and there were about 350, 400 people there, and we discussed the importance of preventing falls. The particular project is called Only Leaves Should Fall. It kind of has a catchy name in autumn. And I think the important down-home message here is that there are more people who die of falls in our listening area than die of murders and suicides combined. And it really shows the importance of trying to prevent falls. And the way you prevent them quite easily and importantly is making sure that you're strong, going to physical therapy if you need it, learning balance and aerobics to get yourself strong, putting night lights up around the house, getting rid of throw rugs that you might trip on, putting grab bars in the shower for people who are senior citizens, and kind of doing, just like you child-proof your house, you may want to fall-proof your house. Very important for senior citizens. If you fall and fracture your hip, there's a 25% chance that if you're 65 and older, that you actually will be dead within 2 years because of the complication of that fall. So we don't take falls seriously, and Wisconsin is always number 1, 2, or 3 in the country in falls, and we don't know exactly why. We make jokes that it's because we drink alcohol, but the reality is in Minnesota they drink as much as we do, and they don't have as many falls as we do. So it's important to get your strength up, make sure your house is fall proof, especially if you're a senior citizen. And if you have any questions, talk to your doctor about this, because doctors are really good at catching up and making sure that you have a safe household.
Very preventable in most cases.
No kidding.
All right, let's get to the phones. We'll start with John in Lake Mills. Hi, John.
Hello, Dr. Zorba. I have high cholesterol, and I've been getting statins twice, and I've been taken off the statins because of side effects to the medication. Besides exercise, keeping my weight down, and eating a healthy diet, is there anything else I can do to try to prevent getting a future heart attack?
You bet it. Lifestyle is really important. Not smoking, getting your weight down, eating a Mediterranean diet, making sure your blood pressure is under good control. All those lifestyle issues. And then there's a drug called Estembi, E-S-T-E-M-B-I-E, 10 milligrams a day. There's a little bit of research that may work in patients who are not statin tolerant. The data is not great on that, but the side effect profile is completely different. It's also under the name brand Zetia, Z-E-T-I-A. I think I would consider that. And of course, in a case like that, fish twice a week or 1,000 milligrams of fish oil, it might also help you.
Okay.
Right, great advice there. Let's turn it over to Tom from Madison. Tom, what's your question?
Oh, hi. Good afternoon, Dr. Zorba. My question is, I'm very frustrated and confused, like probably many, but I can't talk for others. It's in regards to cigarettes, vaporing, per se. I understand the vaping right now is...
Vaping, right.
Thank you. Is very prominent. I'll make this quick. My concern is, okay, cigarettes for years have been a very bad health issue for individuals, and now vaping has got this latest thing. Cigarettes get away with it. They put the warning on the pack. It's your choice. We're not making you smoke. Okay, the vaping, why don't they just put that on the vaping thing you buy?
Sure. So let me chime in for just a minute about the vaping issue in cigarettes. First of all, we know tobacco is awful. It is the biggest toxin in our environment, and vaping may also be just as bad. I've always been against vaping because we don't know what's in there. It's not regulated by the feds. We now know that there have been 250 to 500 cases, especially of young people who have had serious pulmonology, lung problems from vaping. So the answer is, don't vape, don't smoke. That's the bottom line. The only thing that's safe to breathe in is fresh air.
Yeah, people are dying from vaping, that's for sure.
Yeah.
All right, Brian from Fort Atkinson. Hi, Brian. Brian, you there?
I am.
Yeah, what's your question?
So I have a set of varicose veins in my right leg. How can I take the swelling to make the swelling to go down?
Oh, sure. Sometimes it's very hard because there's a valve in those varicose veins that doesn't work. There's some doctors that do something called a sclerosing procedure where they put a chemical in the vein and they actually get the vein to sort of push down so the vein doesn't bother you. Other doctors, surgeons, actually take care of varicose veins. If they're symptomatic and they're problematic, then it's usually covered by insurance. If it's only for cosmetic reasons, insurance doesn't cover it. Something I would talk to your doctor about, especially if your legs feel uncomfortable from those varicose veins. But there's really no good natural way to treat it. It's a valve problem where the valve has actually been destroyed in some fashion.
Yeah, it can be painful, too, in some people.
Yeah, no kidding.
Yeah.
All right, we're out of time, everyone. Thank you for calling in. Zorba, thank you for coming in on your day off.
It's always good to see you.
My pleasure. My pleasure.
We'll have a final